Hello and welcome back. If you're just joining us, you're watching the Arthritis Show. Well, earlier we spoke to a patient who just developing knee pain and arthritis, and we diagnosed him with early osteoarthritis. And one of the good options for a patient like this to get rid of the pain is certainly doing acupuncture. Well, joining us today exclusively in our studio today is Dr. Caldwell. Hello, Dr. Caldwell. Thank you for joining us.
Thank you. It's good to be here.
All right. So, do you deal with a lot of arthritis as an acupuncturist in your clinic?
Yes, acupuncture is a very common condition that we treat. Get good results with that, and I definitely recommend folks who are having arthritis try acupuncture before some of the more invasive procedures.
Some more drastic procedures.
Right.
What percentage of your practice would you say you deal with arthritis?
You know, that's hard to say. It tends to vary. Probably 25, 30%, somewhere in there.
Perfect. That sounds about right. And what is some of the most common pathologies that you get to see as arthritis?
Well, that first patient you had is
arthritis in knee, yes.
Knee osteoarthritis is very typical. And in fact, one of the major research studies on acupuncture and arthritis was on knee osteoarthritis and found it to be very helpful. That was a very large study done in the last 5 years or so. So knee osteoarthritis is very common, low back osteoarthritis, and then cervical. So what I'm seeing, those are the three big ones.
Perfect. You mentioned the study on arthritis of the knee. What was that study done? Was it like a double-blind study, or was it just a study on the patients with acupuncture?
It's hard to do double-blind studies with acupuncture. So they have different ways that they go about doing that. They have what's called sham acupuncture, which is not something that is always very clear because you're still doing some intervention. But they had basically points that are established acupuncture points, and then they had non-points that were off the traditional pathways. And they found that acupuncture worked better than the sham acupuncture.
Okay. And was this mostly done on the knees, this study, or?
Yeah, this is exclusively knee osteoarthritis.
And how many needles usually you put in when you're doing and taking care of the knee?
That's a good question. As few as possible. So we try to address the problem with as few needles as necessary. And, you know, it really all depends because in Chinese medicine, we look at the body differently. So we're not going to treat each knee the same. So it really depends on what the person comes in with, how we're going to treat them. We don't always use needles or pins in the knee directly. We can use points on other parts of the body that also have a systemic effect and can help with reducing the pain and reducing the inflammation of the arthritis.
And what is this, like the second most common joint that you get to see? Knees number one. What would be the second?
Low back.
Low back. And we feel the same probably in our field that one of the most common pathologies that we get to see is knee problem, typically followed by lower back. What we like to do is typically using cell therapy for treatment of our patients, adipose-derived stem cells or platelet-rich plasma. Okay, and what about these meridian points? For audience out there, what are exactly the meridian points?
That's a good question. So in Chinese medicine, we have couple thousand-year track record of treating arthritis and other conditions. The basic way acupuncture works is that from the standpoint of Chinese medicine, there is an energy in the body that we call qi, or bioenergy. From a Western scientific standpoint, this would be electromagnetic energy. And that energy is throughout the body, throughout your cells, also extends out around the body, and that energy tends to travel through certain pathways that we call meridians. Now, basic disease is a result of that energy not flowing in the proper way. So there's going to be some deficiency in the flow of energy. There's going to be an excess, a stagnation of energy. And so essentially acupuncture is working to address the pain or other disease by harmonizing the flow of energy through those pathways. When we're talking about the electromagnetic energy of the body, from a scientific standpoint, what they've found is that there are distinct measurable differences between the skin tissue at acupuncture points and the skin of surrounding points. So, for example, acupuncture points are 0.1 to 0.2 degrees warmer than the tissue surrounding the point. There are also areas that are more conductive to electricity. And so these are some of the ways that science is kind of catching up with the ancient wisdom and ancient knowledge to show how acupuncture works.
You mentioned about the ancient wisdom. I always tell my patients that 3,000 years of Chinese medicine couldn't be possibly wrong, and we're certainly advocates of it. Mr. Garcia, do you have any questions for Mr. Caldwell?
One question. How many treatments does it normally require before you actually start, the patient starts experiencing some benefits from the treatments?
That's a very good question. Ideally, on the first treatment, when the person walks out, I hope that they're feeling better already. Generally speaking, it can take several treatments for it to work. It really depends on the individual. Everyone is different. It depends on the severity of the degeneration in that limb or wherever they're having the discomfort.
And when you work with a patient, do you actually do some objectifying in the sense of x-rays, or do you do any kind of like baseline like that, like you would see like in a traditional medical facility?
That's another good question. We're not acupuncturists in Florida. We're acupuncture physicians. Having said that, we're not doing diagnosis. So that's why we tend to work integratively with the patient's physician. And we'll review the MRIs, review the x-rays, but we're not actually conducting that. So we do, from time to time, we'll incorporate that information, that knowledge into how we treat.
Interesting. So you're basically, your assessment, or whether the patient, when the patient starts getting better, you go by what we describe as the most sensitive biomarker, which is basically how if the patient feels better, then you know that there is some change at the tissue level.
Right. Well, and also, the patient that, the first caller who had the knee pain, she had visible swelling. And so oftentimes we'll see visibly during or immediately after acupuncture that the swelling can go down. And so you can, the patient subjectively will experience reduction in pain, and also visibly there can be changes in the tissue.
Exactly. Yeah. So if you see objective improvements, most of the times the patient will feel better, obviously.
Right.
They run parallel.
Right.
Well, perfect. I want to thank Dr. Caldwell again for joining us. I would love for you to join us again in future shows. Thank you very much. Well, at this point, we're going to go ahead and take a break. When we come back, Dmitry Zhitov will be joining us. Dmitry Zhitov is an instructor in yoga and a consultant to our show with sports medicine. So he's going to be joining us today via Skype. So let's go for a break.